button. Start recording. Start camera chooser. Stop recording button. Speech off. Try again.
Hey you guys, welcome to the channel, or welcome back. I thought in today's video we would talk some about what I've learned from having multiple medical conditions as someone with a disability, someone who is completely blind, and kind of like how to advocate for yourself when you're going into these types of kind of scary medical situations. Either it be like a new doctor's office, an urgent care clinic you haven't been to before, a hospital you haven't been to before. Just these kinds of like situations that maybe you haven't been in before. Because I know it was scary for me the first few times I had to go on my own without assistance, and just knowing how to advocate and how to make it easier for anyone else. And my first big tip is call around to your different hospital systems to see if they use any digital apps like MyChart. I know MyChart's what we use. I know there's several different patient portals, because a lot of that paperwork can be posted online now. So that is really helpful to do any type of paperwork you can ahead of time before you get there, so that way you don't have to ask for as much assistance in office. And then have your have as many doctors as possible. Sometimes, like, I have a few specialists outside of our main local hospital system, but just keep as many doctors as you can, like, within that same system, so that way everything's documented and it makes things a lot simpler. You don't have to ask for as much assistance with filling out new patient paperwork, filling out like paperwork with updating your medical history, because everything is updated within that system. And so that is some tips that I would just would give for like continuing care, would be to get as many doctors as you can within the same system, and get into a system that uses a patient portal like MyChart. And for me, whenever I go to a new doctor's office, if it's not within the same system, like within North Oaks, because North Oaks is the hospital system we use, it is documented in MyChart that I am blind. So that's something you can tell your PCP or primary care to document as one of your like main diagnoses that pops up like on the front of your chart in the digital system, that you have a disability, that you're blind. And that sometimes helps, it sometimes doesn't, depending on the provider that you're seeing. But if it's a doctor within the system, I generally don't call ahead of time, because they don't need to do as much paperwork. So I don't generally have to do new patient paperwork if it's within the North Oaks system. But if it's a if it's a place I've never been to before, and I know I'm going on my own, I will call ahead of time and just say, hey, I am blind, I will, need some assistance with the new patient paperwork. Is that an issue? And, legally they can't fight you. But if they start arguing with you, before you get in the door about assisting you with new patient paperwork, is that a place that you really want to get your healthcare at? So I just always like to call ahead of time and kind of feel the place out and get a sense, and let them know that I will need help, because I've been on the other side of that, and there is just sometimes that the receptionists are slammed and can't sit down with the patient for 10-15 minutes to help them out with paperwork. So I like to call ahead of time and explain my situation, just as a healthcare worker that's been on the other side, so they can put me in a slot where they can help me to the best of their ability. And then once I get in the door, I explain that I can't see, ask them to read the paperwork to me, and help me fill it out, and ask them to show me where the lines are for my signature, and ask if they can date it for me and things like that. And then as far as getting back there, every person with a disability or every person who is blind has a different way to approach how they would like assistance. Some people would rather ask for verbal directions. I prefer to do sighted guide, because a lot of medical offices are tight and it's hard to navigate for me in cramped, unfamiliar areas. So, when they call my name, I'll generally stand up, and if they don't register right away that I can't see, because some people don't have common sense nowadays and don't register that I have a visual impairment or that I'm completely blind. So I'll say, "Hi, I'm Emily. Y'all know I prefer here to go by Nika, but there my legal name is Emily, so that's what they call me by." And so hey, my name's Emily Miller, but I can't see you. I'm completely blind. Can you give me verbal directions or keep talking to me until I find you? And then may I take your elbow? Then I, explain the best way for me to do sighted guide. And then once we get to, the scale, we do all of that. And then once we get to the room, I'm generally good from there. And then once the provider comes in, it generally just kind of depends on the appointment, to kind of depend on what accommodations, if any, I would need from there. If I'm going for any type of CAT scan or MRI, I will generally mark on there that I will need assistance, because for things like MRIs, you can't bring your metal, because most canes are made out of metal. You can't bring that into the room due to the safety risk. So you kind of have to leave that either propped up against a wall or in a in a bathroom, in the dressing rooms right outside, due to the magnets. They just don't want anything to interfere with the magnets. So I always just let them know, at least with North Oaks, again, different hospital systems might do things differently.
1:25 a.m. 2 notifications.
So
Try again.
just let them know what you need as far as that realm. And then, like, as far as physical therapy goes, because I've done that recently, just don't be afraid to, like, explain to your physical therapist what is the best way for you to learn, either hand over hand, verbal explanations, what works best for you. Some do better at this than others. I had a physical therapist about 8 years ago. I think it was about 8 years ago. Damn, 9 years ago. Shit. Excuse my language, but I can't believe it was that long ago since I was in 8th grade. That was just not good. So I just, no matter how much I would tell her I needed the extra help, she was just not good. But I had 2 therapists the last time I was in physical therapy that went just above and beyond to make sure I was comfortable and understood what was happening and really just worked with me. So Andy and Adam at North Oaks Outpatient Rehab, if y'all ever watch this, thumbs up. Love you guys. Can't wait to see y'all again next week. So for when I have to come back. And if any providers are watching this, just listen to your disabled patients. We know what we're doing. Like, we've lived with this disability. We know what we're talking about. Just listen and take our input and combine that with your clinical judgment. Like, don't just assume you know best because you're the provider. You know, we've lived with this disability, so humble yourself and ask questions. Hope that this was helpful. See y'all next time. Bye.
Speech on. Stop recording. Button. Camera chooser. Back. Button. Camera. Stop recording.